Good evening, sports fans and health conscious citizens. Tonight, we're going to take a deep dive into a topic that might make you see your favorite ballpark a little differently. Have you ever noticed the increasing presence of healthcare logos in professional sports? I have. From the New York Yankees, my team, partnered with Montefiore Health System, to the New York Mets, sponsored by New York Presbyterian Healthcare, and it's become as much a part of the game as hot dogs and home runs. But here's the million-dollar question. Do these sponsorships help patients, or are they playing a different game altogether? Now let's break it down. These sponsorships cost tens of millions of dollars. For instance, the naming rights to a stadium can run into the hundreds of millions over a multi-year deal. Now, healthcare organizations, particularly not-for-profits, will tell you this is about promoting wellness and health and community engagement, but we need to ask, where is the money coming from and where could it have been deployed instead? Every dollar spent on a flashy logo, primetime ad spot is a dollar not spent on patient care, not on research, or here's the thought-reducing premiums. Yes, you heard that right. The very premiums you and I could pay could be indirectly funding these high-profile sponsorships. Now, let's be clear. Not all healthcare sponsorships are created equal. Some sponsorships do yield tangible results for their communities. Free health screenings, funding for local clinics, support for youth sports. These can have positive impacts on public health. But here's where it gets tricky. Not-for-profit health systems and insurance carriers have a mandate to reinvest their profits into their mission of providing healthcare. So when they pour tens of millions of dollars into sports sponsorships, we have to ask, is this the most effective way to fulfill that mission? Let's follow the money. Your premium payments go to these not-for-profit entities. They, in turn, allocate a portion of their budget to marketing and community outreach. And a significant chunk of that is plastered across the stadiums and the jerseys. The question is this the best use of your premium dollars? Now, supporters of these partnerships, idiots, argue that increased visibility leads to better brand recognition, which in turn can lead to more patients choosing their services. In theory, this could lead to better economies of scale and potentially lower costs. But in practice, we're not seeing healthcare expenses go down. In fact, they continue to rise year after year. So I have to ask, are these sponsorships really about improving healthcare? Or are they just another play in the game of competition? And here's where it gets more disconcerting. In New York, if you want to build a new hospital, you have to get permission through what we call a Certificate of Need, or CON. And guess who has say in the process? The very same healthcare giants like the New York Presbyterian or Montefiore that are spending tens of millions on sports sponsorships. That raises a serious question. Are these organizations using their sports partnerships to buy influence and maintain their market dominance? And why isn't the governor of New York working on con reform? It seems like a clear conflict of interest when the same institutions that are plastering their names across the Yankees and the Mets jerseys are also the gatekeepers for new healthcare facilities. Let's consider this alternative. Imagine if the tens of millions spent on sports sponsorships were instead directed to reducing wait times in emergency rooms, improving access, and how about rural care, or funding cutting-edge medical research? Wouldn't that be a home run for patients? Now, I'm not suggesting we completely sever the tie between healthcare and sports. When done right, the partnerships can be a powerful force for good. But we need to demand transparency, accountability, and most importantly, more direct benefits to patients and communities. As fans and patients, we have the power and the responsibility to question these partnerships. We should applaud initiatives that demonstrably improve community health while being critical of those that seem focused on brand building rather than patient care. The next time you're watching a game, look around. Count the healthcare logos you see. Then ask yourself, is this improving my health? Is this reducing my premiums? Or is this just a larger part of the game? One where the score is kept in market share rather than healthcare. In the end, the true measures of these sponsorships aren't how well they capture our attention at the ballpark. It's how effectively do they contribute to our well-being as patients. It's time that we demand that when healthcare steps up to the plate, it swings for the fences of genuine patient care. Because in this game, we're not just fans, we're the players, and our health is on the line. It's time to call for a review of these practices, from sports sponsorships to con laws. We need a healthcare system that prioritizes patient care over market share and public health over public relations. Only then can we ensure that every healthcare dollar is truly an investment into our well-being. I'm Dutch Rojas, and Rojas is out.